The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan, and it's a pleasure to be hosting the podcast, and thanks to everyone for listening in. We're going to have a very short podcast today. I just wanted to reflect a little bit on the opinion piece written by John Fetterman in the New York Times, urging the Trump administration to reverse course and actually finalize a Biden-era proposal that would have expanded GLP-1 weight loss coverage to those who had just obesity and not other underlying disease states in Medicare Part D. In general, I think Fetterman is right on the nature of GLP-1 drugs and what they can do. But I am not advocating that right now is the right time to expand coverage in Medicare Part D for these drugs. So let's talk a little bit about GLP-1s before we take our first break. Well, we know that GLP-1 weight loss drugs are all the rage. Hollywood is obsessed and actors are shedding the pounds like crazy. Of course, these folks are wealthy and can afford these very pricey 1,000 plus per month drugs. But the average American has a major affordability issue when it comes to accessing GLP-1 weight loss drugs. Despite propaganda from Big Pharma saying insurance copays are low, the vast majority of Americans really do not have real access to these drugs. First of all, if you have obesity alone and not in underlying disease states, most health plans don't cover the drugs, and therefore it would be out of pocket. But even for those plans that do cover these drugs for disease states like cardiovascular disease or diabetes, if you can get access to the drug through prior authorization processes at health plans, the drug copays for many Americans are very, very high. And so that's sort of the rub. The wealthy can afford these drugs, these very pricey drugs, whereas the average Americans, most of them anyway, really cannot. So again, Fetterman wrote that impassioned opinion piece and plea in the New York Times about broadening access to GLP-1s in Medicare. I really do believe it was very heartfelt. After we get back from our first break here, I will go into details about Fetterman's personal appeal in that piece and what he wants to see from Medicare. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about GLP-1s in a recent piece by Senator John Fetterman that advocated the expansion of such coverage just for obesity in Medicare Part D. So, again, very touching piece by Fetterman in the New York Times. He is a senator, Democrat from Pennsylvania. He is actually very much maligned after being elected in 2022 in what was thought to be a tight contest with a Republican, Dr. Mehmet Oz, who coincidentally now is the administrator of the Centers for Medicare and Medicaid Services. Fetterman had a stroke during that 2022 campaign. He had clear trouble understanding questions during the campaign and equally had a hard time responding. He used technology-based assistive devices to get through debates and other appearances during the election. After winning rather handily in the end, the senator checked himself into a hospital for clinical depression shortly after assuming office. I said he was much maligned because during the campaign and after, Fetterman was attacked as being unfit to hold the office. It actually went beyond criticism to being mocked for his stroke and clinical depression. Also, he has come under intense criticism for his casual dress on Capitol Hill, his trademark hoodie generating both praise and condemnation. I too have an affinity for hoodies, so I was never too much concerned about his dress. Today, things are incredibly different for Fetterman. The senator appears to have fully recovered and has recently stood out as a free-thinking and sober politician, leveling complaints about both parties and urging sanity in governance. It certainly took guts for Fetterman to continue his campaign after a stroke and admit to depression stemming from his physical ailments, as well as the immense political pressure he felt on election to being senator. Back to the editorial he wrote. Fetterman penned an intensely personal piece on how a GLP-1 weight loss drug has changed his life. He went on it for his underlying cardiovascular disease and says it has been transformative for his life. He has lost 20 pounds and has never felt better. Here's a touching quote from that piece. Quote, "Even though I started taking it for my heart health, I've been struck by how much better it has made me feel across the board. It's made a significant impact on my overall health. Aches, pains, and stiffness have vanished. Physically, I feel a decade younger, clear-headed, and more optimistic than I'd been in years. As far as side effects, I've also lost around 20 pounds." End quote. So Fetterman really does believe the GLP-1 has been transformative for his life as well as can be for others. In the piece, Fetterman urged the new Trump administration to change course again and back the Biden administration's push to have Medicare Part D cover these weight loss drugs when tied only to obesity and not an underlying other qualifying disease state, such as diabetes or cardiovascular disease. As the senator notes, millions of Americans have seen the benefits of the drug. I have told you before that I am a recent convert on these drugs, and I am on the same drug Fetterman is. For me, it was an underlying disease state of diabetes. I went on the drug just over a year ago. Over that time, I have lost about 55 pounds. All of my diabetes numbers are now well within the safe zone. My high cholesterol, my high triglycerides, and my high blood pressure are now gone. Fetterman is right too when he refers to your better emotional health when you are on a GLP-1. While I was always highly motivated, my optimism and outlook seem much better and greater today. I am eating better and exercising. So, like Fetterman, I have never felt better, save for maybe my teen years and college days, I guess. I don't like relatively new drugs for fear that there are unknown side effects we will see years down the road. But I cannot question the life-changing nature of GLP-1s and other weight loss drugs. Fetterman makes the case that opening up coverage for more disease states as well as obesity alone could be transformative for people's lives in our healthcare system. He argues that the government now has the ability to negotiate drug prices, and that would mitigate the increased spending on the pricey $1,000 plus a month drugs, which is a gross price. He makes the point that the drugs could reduce chronic disease costs over time, which would mean offsetting savings. With that sort of discussion of Fetterman's piece, I will come back and tell you my views on his proposal after the second break. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about GLP-1 coverage in Medicare and Senator John Fetterman's proposal to expand it. This was proposed by the Biden administration in a recent rule, but Trump has abandoned it. There is no doubt Fetterman is right over the long term. Nonetheless, until we do have substantially lower prices in place for GLP-1 drugs, it is hard to make the leap to expand coverage of GLP-1 weight loss drugs in Medicare. I know this sounds selfish since I have told you I benefit from them, but here is my rationale. I read with interest that the Congressional Budget Office, or CBO, now says the Medicare Part A trust fund won't go bankrupt until 2052. That is about 20 years longer than predicted last year. It is hard to take a lot of stock in the exact dates that Medicare's hospital fund will run out of money, given all the assumptions that have to be made. On the other hand, though, it is good news that the date appears to be later than once thought. But the fact is that we are still talking bankruptcy of a major government program, perhaps in my lifetime, but certainly in my children's lifetime. What's more, outpatient services are paid from general government funds and beneficiary contributions. Costs in Medicare appear to be growing right now by as much as 9% annually. Even if this moderates, the sheer costs of Medicare over time will mean greater and greater government appropriations and increased beneficiary costs in terms of premiums, deductibles, and cost sharing. That's even if the predominant 20% cost share is not increased from a percentage standpoint later. The retail drug program is funded from the same outpatient fund. We see costs in the Part D program surging from GLP-1s for disease states, specialty drugs, and the sheer weight of increased utilization in high prices of drugs. Further, the Biden administration and Democratic senators passed a poorly designed and politically motivated Part D cost-sharing reduction plan in 2022 in what is known as the Inflation Reduction Act. The Democrats didn't really fund the reductions in beneficiary cost-sharing and instead transferred most of it to plans that sponsor the benefit either in Medicare Advantage or the standalone Part D program known as PDPs. This meant a huge surge in costs, so much so that CMS had to step in and create what I think is an extra legal program to shelter the public from the massive premium increases that would have resulted in the PDP program. Even the Trump administration is continuing the program because it simply doesn't know how to get out of the hefty financial commitment and otherwise shelter the public from increasing costs. Costs of the changes will only rise in the future as well. It's a mess. The Part D cost-sharing fiasco shows the danger of well-meaning benefit expansions in Medicare. The IRA change for Part D cost-sharing is literally threatening to increase premiums in the PDP program phenomenally over time. Already, premiums and cost sharing has increased notably, and benefits and offerings have been cut. The PDP program financially is a mess, in large part due to the IRA changes. With that, we will take our third break, and we'll come back to conclude on some of my views and what perhaps we could do about it in an alternative. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about Senator John Fetterman's recent New York Times opinion piece urging the Trump administration to expand GLP-1 drug coverage in the Medicare Part D program. Well, the Trump administration certainly looks mean to refuse to increase weight loss drug access. But in many ways, it is being fiscally prudent right now. Anytime you increase one benefit in a government program, as I told you before the break, that is unpaid, it will generate increased costs in other areas. It is inevitable that it is funded by premium hikes, cost-sharing increase, and benefit reductions elsewhere in that benefit or the program. So those who need GLP-1 drug coverage would win, but so many others would lose. More important, the move by Biden was not only fiscally irresponsible, but as I told you, brazenly political. On the issue of Medicare drug price negotiations, noted by Fetterman, I am with him in principle, but for the 10 drugs from year one of negotiations in 2024, the Medicare drug price negotiations will only reduce drug prices in 2026 by an average of 22% on a net post-rebate basis. While some GLP-1s are on the docket for negotiations in 2025, for a price effective date of 2027, we don't know yet what the negotiated price will be. If it is the average 22% decline, the savings would be too small in the short term, considering the ongoing growth of GLP-1 costs due to the use for diabetes and other disease states, and the new costs that would result from those that would obtain the drug for obesity alone. There also are concerns that many do not stay on the drug over the long term to mean real savings. Admittedly, at least part of the erosion of adherence to GLP-1s might be about the overall price right now. Thus, though, extending GLP-1s now to obesity and Medicare would compound the effects caused by the IRA Part D cost-sharing changes, further compromising the financial stability of the PDP program, as well as eroding benefits further in both PDP and MA. So what might be a solution here? Well, we could be very aggressive on price negotiations for GLP-1s in 2025 and get the prices down for such drugs for 2027 close to what is paid in other developed nations. In general, the prices outside the U.S. is a range of below $100 at the low end to less than $450 at the high end, depending on the actual drug. Then, if that occurs, we could have a more deliberate discussion about short and long-term costs and the benefits of expanding GLP-1 coverage in the long term from both a financial standpoint and the health of individuals and the healthcare system. With that, We'll conclude this edition of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.